Hello, my name's Victoria Chamorro, and I'm with a consultant psychiatrist at the Priory, Hampton, and I'm here to talk about the most Googled questions about mental health. The first question is neurodiversity a mental health condition? It's a complicated one, this one, because the answer is yes and no. Neurodiversity refers to people that are wired slightly differently from, should we say, neurotypical people. That doesn't mean that how they are wired is wrong or disordered, just different. Where it becomes more complicated is that society is largely set up for neurotypical people. And so it's a round peg in a square hole. And sometimes some approaches might be able to assist you to be able to engage with societal practices. Obviously, if it's starting to be totally overwhelming and you're unable to engage with life, that really is detrimental. And that's where some of the treatments can help. Can you get depressed for no reason? I don't think that you can get depressed for no reason, but I think you can get depressed for no obvious reason. So depressive episodes are an interplay from largely genetic and psychological factors that you may or may not be aware of. What might feel like a depressive episode coming from the blue is actually a complex interplay of these factors. Is alcohol a depressant? Yes, alcohol very much is a depressant. It's a very strong depressant. We use it as a party drug. That's not really the neurochemical effect that it has. It's actually a much stronger depressant agent than our antidepressants are an antidepressant agent. So really, if you're struggling with your mood, then alcohol is often one of the first things to give up. Can OCD make you believe things that aren't true? No, I don't think OCD makes you believe completely untrue things. But what it does is overemphasize risk or matters of uncertainty. For example, you can never guarantee, that someone doesn't have germs on it. But it's a much overvalued risk in somebody with OCD. OCD and other anxiety disorders picks on this uncertainty, so you are unable to fully reassure yourself. And unfortunately, that's how the illness works. If you were able to fully reassure yourself, then it often moves into a different topic where you can't. So it plays on our normal concerns about uncertainty and blows them well out of proportion. Can men get postnatal depression? This is an interesting one. There is a clinical syndrome called postnatal depression, and that can only happen in women. It's largely a physical illness that happens after you give birth, in that initial postnatal period, which is about 1 to 2 months. And it's a very physical thing that happens to women related to the sudden absence in hormones, as well as the psychological effects of having a newborn. Men definitely can be depressed in the postnatal period because there's a huge amount of change that they're undergoing as well. Not only have they got the uncertainty of the new role of being a dad, but also maybe a caring role of looking after the newborn and mum, and many complex factors that might be involved. But the true postnatal depression really does refer to women. Is thinking about the past a sign of depression? No, I don't think thinking about the past as a standalone is a sign of depression, but potentially being stuck in the past might be. So this is ruminations about regrets or thinking that the past is more relevant to you than maybe the future is, and feeling quite hopeless about the future and so dwelling in the past. These are factors that make me think that you might be suffering from a depressive episode. Does coffee worsen anxiety? Unfortunately, yes. It can make you more anxious in itself and also gives you the physical symptoms of anxiety, which also promotes anxiety. Is social media bad for my mental health? I think social media is a double-edged sword. I think it can be very beneficial for your mental health in helping you engage with other people, make new connections, and also help you with practical things like how to do things, hobbies, and that sort of thing. I do think it can be bad if it becomes all-consuming or you start going down a kind of negative spiral into very negative topics, or you're engaging with some unpleasant people, which can be very common on social media. So I don't think social media in itself is neither good or bad, but the situations you find yourself, just like in any aspect of your life, may be good or bad for your mental health. Does everybody get anxiety? Yes. Anxiety affects absolutely everybody. And actually it lets you identify threats and prepare for them. So actually it's quite a good force in our lives. Where it becomes negative is if it becomes overwhelming. Are physical and mental health related? Absolutely. So we used to have a kind of mind and brain dichotomy, which we don't really think exists anymore. Absolutely, the things that affect your mind affect your brain, and things that affect your brain affect your mind. We are totally attached to our bodies, so our physical symptoms interplay very strongly with our emotional states. If we think about things like a panic attack, the anxious thoughts stimulates the fight and flight response, which makes you have all the symptoms like palpitations, shortness of breath, tingling of the fingers, and that in itself makes you more anxious, which stimulates more anxious thoughts, which makes the physical symptoms worse. So as you can see, there's a completely intimate interplay between them that really is very hard to distinguish. Do people with bipolar disorder hear voices? Absolutely they can, but not always. Typically they'll hear voices when they're either feeling very high or very low, and those voices generally agree with that mood state. So they have what we call grandiose hallucinations when they're very high, when the voices might be saying very positive things, and then very negative things when they're feeling very, very low. Sometimes that is experienced like a voice talking directly to them, sometimes about them, and often and typically goes with the disorder being treated. Can you get PTSD from a breakup? In the normal run of things, I don't necessarily think that you can get PTSD from a breakup, even though a breakup is incredibly distressing. PTSD is defined as a reaction to a life-threatening or catastrophic trauma. And that can happen in situations of domestic abuse or in serious circumstances such as litigation or other threats to that particular person. That is not to say that a breakup is not distressing. It absolutely is, but it might be that you're suffering from a different mental health disorder, or just experiencing human distress, which in itself is not an illness, but you might need support. What is generational trauma? Generational trauma is the idea that the effects of trauma on one generation, so maybe your grandmother, will affect 2 or 3 generations down. There's very many reasons for this. Your grandmother might have had a very terrible experience, which has then maybe affected her parenting style, which has then affected how your mother relates to people. And then obviously that affects how you relate to other people in the world. And so you can see how trauma is passed down through the generations. There is also postulated a biological approach where the folding of DNA is an expression of proteins is changed. This is called epigenetics. And it's likely that is also affected by trauma, affecting multiple generations. Am I depressed or just sad? So sadness is something that every single human experiences, and it's a period of low mood that hopefully spontaneously resolves. Where it becomes depression is when it's lasting for a longer period of time, 2 weeks or more, and it is associated with other symptoms, such as feeling really tired or not getting the same kind of enjoyment out of life. Or it's becoming generalized, so you're starting to feel sad about all aspects of your life. And that's some of the red flags to try and get some help. Am I trauma dumping? So whether you're trauma dumping or not really depends on the context of the disclosures, and likely more to do with the listener's experience than necessarily the person actually talking. If the listener was not expecting or consenting really to the disclosure, then it can be very difficult and overwhelming for them. People who aren't trauma dumping, who are sharing experiences, it's more of a two-way conversation with lots of check-ins to make sure both parties are okay. Obviously, sharing experiences is totally appropriate with loved ones, family members, and mental health professionals, but in the context that has been very clearly signposted what the conversation is about. Trauma dumping is also a sign that that person is really struggling, and they're using every opportunity they can because they're bubbling over with distress. So you can absolutely see why people would do this, and absolutely it's not a sign of any malicious behaviour at all, but really an indication of how much they're struggling. Why is anxiety worse in the morning? There are a number of reasons why anxiety is worse then. Partly it's because of the circadian rhythm of mood, where actually your cortisol spikes first thing in the morning, and people wake up with that physical sensation of anxiety. There's also some psychological factors. We call it anticipatory anxiety, where you're thinking about the stressful events coming up. That might be a difficult conversation with somebody, or it might be that you feel a bit lost and that you don't have enough structure, and so you're not going to be knowing what to do with yourself. It's also a time that we check in with ourselves and we're quiet. And if your own thoughts are very ruminatory and overwhelming, then that can be more difficult and distressing to have closer contact with without distraction of doing something else. How can I help someone with mental health issues? So the most important thing that you can do is listen to somebody and to be that shoulder to cry on, to validate their experience, but also to help notice the red flags that mean this is more than what somebody can cope with on their own and that they might need professional help. That might be things that they're feeling overwhelmed. They can't cope with their normal routine, and actually a period of rest is not helping things. These are all signs that actually they should seek further help. Can depression run in a family? Yes, absolutely. There are many factors at play, including the genetic aspects and also psychological aspects, such as parenting styles and learnt behaviours on how to deal with stressful situations. And also sometimes difficult interpersonal relationships in themselves can be difficult. Yeah, absolutely it can. Can health anxiety cause fake symptoms? Health anxiety is a preoccupation with your physical health, and that runs the gamut from all the way from a particular diagnosis to feeling that something might be life-threatening. That causes an anxious response, which might look like a panic attack. Those are not fake symptoms as such, but they might not be attributed to the cause that person is imagining. It also might be that without distraction or with intense scrutiny of yourself, you are overvaluing particular sensations that you're attributing to a disorder that might not be. But again, these aren't fake. They're just maybe not the cause you think they are.